Hello, I'm Dr. Kristen Moeller, Director of the Contra Costa Family Medicine Residency Program. I'm excited that you're interested in our nationally recognized program located here in the beautiful San Francisco Bay Area. To give you an idea of the primary care clinic experience, we've created this short video showcasing our residents in the 3 continuity clinic sites. We strive to be diverse and inclusive as we provide high-quality care to our patient community. I hope you enjoy this small window into our clinic experience here in Contra Costa County and begin to see why Doximity ranks us in the top 10 nationally for family medicine residency programs.
I really love this clinic, and I remember when the incoming class were choosing clinics, I would talk up West County Clinic a lot because I'm really proud of it. I'm really proud of representing this clinic. I'm really proud of the patients we serve, of the staff we work with, of the location that we're in, of the services we provide. And be ready to get hugs from your patients too, because they're gonna be really thankful. A lot of these patients did not grow up with routine healthcare. And so having the opportunity to come to a clinic in which people are trying to understand their hardships and helping them out in terms of healthcare is important. We do quite a few procedures here, such as women's health procedures. So they're pap smears, endometrial biopsies, Nexplanon and IUD, which are birth control contraceptive method placements. Something very unique about this clinic is our pipeline work that we do. So for those who don't know, pipeline work is basically idea that those who are in health professions careers, they go back to the communities they were from, or they go back to classically under-resourced communities, and they try to assist students in getting to where they're at, which is a health professions job. I definitely think West County Clinic is dedicated to things like pipeline programs and going back into the community and being involved in community engagement with the goal of increasing the number of healthcare providers from classically marginalized communities. Advice I have is get ready to work, get ready to do some hard work, and get ready to be fulfilled. I can't wait for you all to come and visit us here at West County and be integrated into our community.
I love Martinez Health Center. There are a wonderful set of staff and faculty who precept here. We have access to lab, minor procedures, radiology. I love that it's just a stone throws away from the hospital. I can go back and forth as I need for consulting, for supplies, to do a delivery on L&D for one of my continuity patients. I see such a wide range of patients. Everything from, I have county employees, I have people who have just lost their insurance and been kicked out of other systems, who've been in the area forever. I have tons and tons of immigrants from all over the world. Afghanistan, Iran, India, Nigeria, Central America, and patients who are homeless, patients really from all walks of life. I mean, Contra Costa is just a different ball game, right? It is family medicine. I think the beauty of family medicine is its philosophy. It's not a specialty based on age, gender, organ system, or mode of intervention. It's about care in the context of family, continuity, and comprehensiveness. And Contra Costa takes all of those really well and then takes it to another level, which is you're a broadly trained generalist physician who can respond to the need of their community, whatever that might be. If you need to do surgery, if you need to do OB, if you need to do ER, if you need to do ICU, if you need to do addiction medicine, if you need to do group therapy, whatever it might be, you're equipped to do it with the foundation you get here.
I love my patients. They're a phenomenal group of people that I have learned so much from over the past 3 years, both about just kind of their general medical conditions, healthcare maintenance, social issues. I love that I have a really diverse patient population. I'm someone who loves languages, so I speak Spanish maybe a quarter to half of the day. Here I get to use the interpreters for Vietnamese. I have a lot of Afghani patients. It's nice to just see kind of a whole mix of different people from different cultures, and then all different ages. I love maternal health and pediatrics, so I think about a quarter of my patients are pediatric patients, many of whom I've delivered and who I get to be the provider for, not just them, but their parents, oftentimes their grandparents as well. So it's just nice to see a mix of ages and to be able to care for families. And I think now, as I am coming to kind of the end of my residency, saying goodbye to patients that I've gotten to know so well over the past 3 years is really hard, but it makes me realize kind of how meaningful the experience has been for us. So we get to do a lot of procedures in the clinic. I do a lot of women's health procedures, so endometrial biopsies, pap smears, IUD and Nexplanon placements are really common, knee injections or other joint injections for arthritis, do a lot of derm procedures, skin excisions. We also have an ultrasound in the clinic, so we can do a lot of ultrasounds. A really useful and nice part of being in the clinic that you can provide a lot of procedural care for your patients. So Pittsburgh is a really interesting place to work. Within Contra Costa County, we've seen a lot of movement of communities and families from the western part of the county, which is closest to San Francisco, the Oakland and San Pablo area, to the eastern part of the county, which is where Pittsburgh is situated, just because there's a lot of gentrification and increasing housing prices, so families are no longer able to afford those housing areas and are moving out here. So the growth of the population has been really huge in the past several years, and there's a huge gap in sort of the need for providers and the number of providers there are. So it's a really wonderful place to be because I feel like I'm able to meet a need that my patients really have, and I'm helping the county provide care for patients that would otherwise go really underserved. I would say that this is a fantastic place to come work as a resident.